I'll go visit first and feedback saying that they're very happy. So I should be getting some the gentleman's friends, colleagues, no doubt booking next week. So that's the wax plug. You can see all the hairs that are matted and provide the structure. It's quite dark here, wax. We know the wax has been there for a while, it's oxidized. That's the right plug. So the one that the tinnitus is any sound that originates or is perceived inside the ears of the head. So in other words, it's not an external sound that you're hearing, it's an internal generated or perceived sound. And there's a minimum one causes for tinnitus. Earwax can be one of those. So by removing the wax, sometimes it can help people with tinnitus. But as I said, if you do suffer from tinnitus, don't assume it's wax. I would recommend seeing your doctor, GP, nurse, local audiologist. We do get a lot of phone calls after I mentioned tinnitus on the video, for example. People suffering from tinnitus for many years and they're not sure if it's wax. So the first thing, just go and get your ears examined first. And of course, if it is wax and you want to come visit and remove it, do come along and do that. But we just had quite a few people that attend who don't have wax, and their tinnitus is sometimes we just don't know the cause of why people develop tinnitus in the first place. So now, if you are suffering from what we call unilateral tinnitus, or tinnitus in one ear, or asymmetrical tinnitus, so tinnitus would be more apparent and more definitely more noticeable in one ear compared to the other. So you have it in both sides, but one ear is worse. Or you suffer from pulsatile tinnitus, so it could be cardiosynchronous, so in rhythm with your heartbeat, or non-cardiosynchronous sometimes as well. I would get that checked by your doctor as well, because that may need onwards and referral for further investigation. So with this patient, it was due to the tinnitus, and they actually had their ears examined prior to coming. It was really lodged. They were guilty of using cotton buds for patients that opened valves here. So they won't be moving forward, thankfully. And they really pushed this right against the eardrum. And they've been also using hydrogen peroxide drops, which if you've been watching my channel, it's not a drops that I'm particularly fond of, because hydrogen peroxide drops turns the wax really mushy and gluten. It's just like in this particular patient, but sometimes even worse. It's just a little bit of staining there on the antennas. We could leave that, but I'm just going to hover over it. If it comes away, brilliant. If not, we'll just leave that. It's not going to cause any problems. This part of the ear is a very difficult part of the ear to gain access to. We just want to avoid touching the anterior canal, so the bony part of the ear comes to the left, so it's very sensitive. I'm just going to mop it on the outer third, the cartilaginous portion. So again, it's just a bit of staining that will dry up. So the way hydrogen peroxide drops work, as they enter the ear, they react with an enzyme called oxidase, which is secreted by the ceremonous gland, which is a modified sweat gland in the ear. And when it reacts with perioxidase, hydrogen peroxide converts from a liquid partially into a gas, so into oxygen, and during that transformation phase we get effervescence, we get a bubbling, mechanical foaming. So quite often if you use hydrogen peroxide drops, you can hear it fizz and buzz in the ear, and that's just the hydrogen peroxide drops converting into a gas into oxygen. And that effervescence is designed to break up little skin cells that form the majority of the skin, around 60%. And hydrogen peroxide also then converts into water. Dead skin cells in the wax plug absorb the water, they swell, they overhydrate, and then the cell membranes burst, they rupture the bank of water, and that will also again break up the skin plug. Problem with hydrogen peroxide drops, it leaves the wax really mushy, glutinous, it makes it more difficult to suction. Hydrogen peroxide drops, although it's antiseptic, but being alkaline and water-based, it can macerate the skin, and that's lining the ear canal and partly breaking down the skin that's lining the ear canal, so we don't really want that. and the alkaline nature of hydrogen peroxide drops changes the pH of the ear. The ear is naturally slightly acidic, and the acidity helps to inhibit certain bacterial growth. So it helps to prevent infection. Also, the acidity is a natural insulin, so by increasing the pH level of the ear, which is what hydrogen peroxide drops does, it turns the ear from an acidic to a less acidic, and even sometimes an alkaline pH. So that's why I'm not a big fan. Now, they're right here, they hadn't been using any drops. In fact, in terms of quantity-wise, there was a lot more wax here. This plug eventually came out in one large plug. It was quite a matted plug. Loads of skin cells, dry matter that's forming this. So earwax, if you think about the plug, you've got the meshwork. So 60% there or thereabouts. And we're talking about Western earwax, where there's 60% earwax, 40% oily sweats and lipids. Far East earwax is more skin oriented, so 80%. It's a bit more of a dry type of wax. But the core of the wax plug is dry matter. So when we say dry matter, we mean exfoliated skin cells that around the ear canal, the hairs, and the debris sometimes that enter the ear from the environment. They provide the structure, the scaffolding, the meshwork of the wax plug, and then you get the oily sweats and lipids then secreted by the glands, various glands, the sebaceous glands and the modified alkaline glands, also the seminal glands. And these oily sweats and lipids fill in the meshwork, fill in the gaps, and that's how you have an earwax plug develop. So you can see all the hairs here. Now, this is really large. You're going to see me in a minute. I'm going to come out and I'm going to go to the posterior canal wall. So to the left, back part of the ear. I'm going to loosen it from there. And once I loosen it, I'm going to slowly pull the wax plug out. And I'm going to curl it around the ear. So the patient, all of our ears are bended with a sigmoid shape, so an S-bend. So the first bend is about half a centimetre into the ear, the second bend is another half a centimetre into the ear. And it's there for a reason. The bends in the ear are important. They help to protect the eardrum. So if you have a sharp foreign body enter the ear, you're going to have to navigate the two bends of the ear canal prior to approaching the eardrum. So the bends help to protect trauma to the eardrum from foreign particles that may enter and may be harmful. But then it's sometimes difficult to remove wax because you have to circumnavigate the wax around the curvature of the bends, which you can see from left to right. The entrance, and then from right to left, this is the first bend if you want to go around. This is quite a sizable piece. At the end of the video, I'm going to put it side by side with a pencil so you can get some perspective. Now, this is really uncanny. I mentioned it to the patient because they're right here. It looks like my eardrum. Eardrums are very distinctive, and the ear canal itself, mine's is probably a bit more hairy around the edge. But it's uncanny. This looks very similar to my eardrum. Even the shape of the eardrum, it's not a complete circular disc, it's tapered now at the top severely. So yeah, it's a bit of deja vu there. So I'm just mopping up around the edge. Again, we can leave this, it's not going to cause much of a problem. The kind of cartilage portions there, I can put a bit of pressure here. Think about the ear. The outer third is what I call the safer zone, and the inner two thirds is the danger zone. You've got to be careful. We don't want that contact with the band of the ear because it can be uncomfortable. I'm just trying to lift that off the base. There's a few hairs there as well. And it's a big difference for the patient. I've been like this for a while. Ironically, the patient heard about me in the pub. One of the friends noticed that he wasn't hearing as well, and I heard about the clinic. So, but it transpires that a lot of people in the pub are having problems with their ears because of the earwax they feel. So the patient was like a guinea pig. They're going to start that. I'll go visit first and feedback. So they're very happy. So we should be getting some. The gentleman's friends, colleagues, no doubt booking next week. So that's the wax plug. You can see all the hairs that are matted and sort of on the structure. It's quite dark here wax. We know the wax has been there for a while. It's oxidized. That's the right plug. So the one that